Right now, in the next 60 seconds, you are going to learn something that most Americans over 60 have never been told. Not by their cardiologist, not by their primary care doctor, not by anyone. The majority of people who survive a heart attack do so not because they were lucky. They survive because someone, or they themselves, knew exactly what to do in the first 3 minutes. Most people freeze. They wait. They second guess what they're feeling. And that hesitation, those minutes lost to confusion and fear, is what turns a survivable event into a catastrophic one. If you are over 55, this information is not optional. This is the conversation your doctor should have had with you years ago, and didn't. My name is Dr. Elena Marsh. I'm a cardiologist with over 20 years of clinical experience. I have stood at the bedside of patients who made it and patients who didn't. And the difference between those two outcomes almost always came down to one thing. What happened in the first 3 minutes before paramedics arrived? I've reviewed the most recent data published by the American Heart Association, and the findings are stark. According to their 2022 Heart Disease and Stroke Statistics report, nearly half of all cardiac deaths in the United States occur outside of a hospital. That means the outcome is decided, not in the emergency room, but wherever you are standing when it begins. Today, I'm going to give you 3 specific techniques for exactly that moment. Techniques that are free, that require no equipment, and that you can remember for the rest of your life. I call this the Cardiac First Response Protocol. And by the end of this video, you will know it completely. Quick question before we go any further. If a heart attack started right now, would you know what to do in the first 3 minutes? Type yes or no in the comments. I read every single one. Before I give you the protocol, I need to make sure you understand exactly what is happening inside your body when a heart attack begins, because that understanding is what makes the protocol make sense and what makes it stick. A heart attack, the medical term is myocardial infarction, begins when blood flow to a section of your heart muscle is suddenly blocked. Most of the time, this happens because a plaque buildup inside a coronary artery ruptures. When that plaque breaks open, your body treats it like a wound. It sends platelets rushing to the site to form a clot. But unlike a cut on your skin, this clot forms inside an artery, and it can seal it completely. Here is what that means for your heart specifically. The moment blood supply is cut off, the muscle cells in that region begin to die. Not in hours, in minutes. Cardiologists use the phrase time is muscle, and that phrase is not a metaphor. Every minute without blood flow, approximately 2 million heart muscle cells are lost. That damage, depending on how long the blockage lasts, can be permanent. Here is where it gets critical. The average time between when a heart attack begins and when a patient in the United States calls for emergency help is over 2 hours. 2 hours. The research on this has been consistent for decades, published as recently as 2021 in the journal Circulation. And the reason is always the same. People are not sure what they are feeling. They minimize it. They wait to see if it passes. Your body does not send clear signals the way television shows you. It sends ambiguous ones. And if you don't know what to listen for, specifically, you will almost certainly talk yourself out of acting. So before we get to the protocol itself, I want you to know exactly what your body may actually be telling you, because the signals are not always what you expect. Most people think a heart attack feels like a fist squeezing the chest. Sometimes it does, but in adults over 55, especially in women, the symptoms can be far subtler. A dull pressure between the shoulder blades, nausea that seems to come from nowhere, jaw pain that you attribute to dental work, unusual fatigue that settles in the middle of the day, a feeling of heaviness in the left arm or both arms that you mistake for tension. A 2019 study published in JAMA Internal Medicine found that women experiencing heart attacks were significantly more likely than men to present with symptoms other than chest pain, and significantly more likely to have their symptoms attributed to anxiety, acid reflux, or stress before a cardiac cause was identified. Your symptoms may not feel like a heart attack. That is the first thing you need to accept. And that acceptance, that willingness to take the ambiguous signal seriously, is what gives you the time to use the protocol I'm about to give you. Stay with me, because what comes next is the part your doctor assumed someone else had already told you, and no one did. Now, I want to go deeper, because understanding the biology of what's happening is what separates someone who acts from someone who waits. When that coronary artery closes, your heart doesn't shut down all at once. It sends a distress signal through your nervous system. This is what produces the symptoms you feel. And here is the critical problem. Your nervous system is not precise. It cannot point to the artery and say, this is the source. Instead, it refers the pain outward, to your jaw, your back, your arm, your stomach. This is called referred pain, and it is the single most dangerous feature of a cardiac event because it is almost universally misinterpreted. There is a second mechanism working against you at the same time. When your heart is under severe stress, your body releases a surge of cortisol and adrenaline. This is your fight or flight response, and it is designed to help you survive a physical threat. But during a heart attack, it creates a cruel paradox. Your heart rate increases, your blood pressure spikes, your blood becomes more viscous, thicker, harder to move through already narrowed vessels. The very system designed to protect you is accelerating the damage. A study published in the European Heart Journal in 2020 confirmed what cardiologists have observed for decades. Patients who experience high cortisol surges during the early phase of a myocardial infarction have measurably worse outcomes, larger areas of damaged tissue, longer recovery times, and higher rates of secondary cardiac events within the following year. Your stress response in this specific situation is working against your heart. This is also why panic is dangerous. Not metaphorically, physiologically. Every second you spend in a state of unmanaged panic is a second your heart is working harder than it needs to under conditions of reduced blood supply. The protocol I am about to give you addresses this directly, not with reassurance, but with specific physical actions that interrupt this cascade at the biological level. There is one more layer to this that most people never hear. The damage from a heart attack is not limited to the moment the artery closes. There is a secondary wave of injury that occurs in the hours after blood flow is restored, whether by the body's own mechanisms or by medical intervention. This is called reperfusion injury, and it happens because oxygen-starved cells, when suddenly flooded with blood again, release inflammatory compounds that damage surrounding tissue. The Journal of the American College of Cardiology published research in 2018 identifying reperfusion injury as responsible for up to 40% of the final infarct size, meaning nearly half the long-term damage from a heart attack happens not during the blockage, but after it is resolved. Why does that matter to you right now? Because the actions you take in those first minutes, before the ambulance arrives, before you reach the emergency room, directly influence how severe that secondary injury will be. Staying as calm as possible, keeping your body in the right position, making the right call at the right moment. These are not passive choices. They are clinical decisions with measurable consequences. You've been told your whole life that a heart attack is something that happens to you, something you wait through until help arrives. That's not what the research says. Has your doctor ever explained any of this to you? The cortisol surge, the referred pain, the reperfusion injury? Write never or yes in the comments right now. Your answer matters more than you think. Now here is what connects all of it: the freezing response, the misread symptoms, the cortisol cascade, the reperfusion window. Every single one of these mechanisms has a corresponding action, something specific you can do in the moment that directly counteracts what your body is doing wrong. That is exactly what the cardiac first response protocol is built around. Not generic advice, not call 911 and chew an aspirin, though we will talk about aspirin and the specific way most people get it wrong. 3 targeted interventions, each one addressing a distinct biological mechanism, each one actionable in under 60 seconds, each one supported by published research. Stay with me. The protocol is next, and it starts with something almost every person does instinctively in this moment that makes everything worse. Here is exactly what I want you to do. Starting today. This is the cardiac first response protocol. 3 steps. In order. Each one targets a specific biological mechanism that determines whether the next hour goes in your favor or against you. Learn them now before you need them, because the moment you need them, there will be no time to look anything up. Step 1. Stop moving and get into the recovery position. Do this within the first 30 seconds. The instinct when something feels wrong with your heart is to do something, to stand up, to walk to the phone, to get to the car. This instinct is one of the most dangerous things you can do. Physical exertion during an active cardiac event increases myocardial oxygen demand at the exact moment your heart's oxygen supply is compromised. Every step you take, every flight of stairs you climb, every sudden movement you make forces your heart to work harder against a closing or closed artery. Research published in Circulation has shown that patients who remained still in the early phase of a suspected cardiac event had significantly better preservation of cardiac tissue compared to those who continued physical activity while seeking help. What you need to do instead is sit down immediately. or lie down if sitting is not possible, with your back supported and your knees bent. This is not rest. This is a clinical decision. It reduces the cardiac workload, lowers your blood pressure, and slows the cortisol surge we discussed. Do it within the first 30 seconds of recognizing that something may be wrong. You do not need a diagnosis to sit down. Sit down first. Assess second. If you are alone, get to the floor slowly and carefully before you do anything else. The floor cannot fall. A chair can tip. Your body needs to be stable before you make the next move. Step 2. Call 911 immediately and say these 4 words first. Most people know to call 911. What most people do not know is how to communicate in a way that triggers the highest priority cardiac response from the dispatcher. When the call connects, the first 4 words out of your mouth should be, I think heart attack. Not, I'm not feeling well. Not, I have chest pain. Not, I might be having some kind of episode. 4 words, I think heart attack. Those words activate a specific dispatch protocol in virtually every emergency system in the United States that prioritizes your call, routes the nearest available unit, and in many systems, triggers automatic notification to the receiving hospital before the ambulance even reaches you. A 2017 analysis published in Pre-Hospital Emergency Care found that door-to-balloon time, the critical window between hospital arrival and arterial intervention, was significantly shorter for patients whose 911 calls contained explicit cardiac language in the first 15 seconds. The dispatcher's first words activate a chain. Your words activate the dispatcher. Say them clearly. Say them first. Stay on the line. Follow every instruction. Do not hang up to call a family member. Do not hang up to unlock the front door. The dispatcher can guide you through everything, including how to unlock your door without leaving your position on the floor. Step 3. Chew 1 regular strength aspirin, 325 milligrams, if you have it and if you are not allergic. You have probably heard that aspirin helps during a heart attack. What most people don't know is that how you take it matters as much as whether you take it. Swallowing an aspirin whole during a cardiac event is significantly less effective than chewing it. When you chew aspirin, it is absorbed through the mucous membranes of your mouth and reaches your bloodstream in 3 to 5 minutes. When you swallow it whole, absorption through the gastrointestinal tract takes 15 to 20 minutes or longer, especially if blood flow to the gut is already reduced, which it often is during a cardiac event. The mechanism is direct. Aspirin inhibits thromboxane, A2, a compound your platelets release that promotes clot formation. By getting aspirin into your bloodstream as quickly as possible, you are directly interfering with the clot that is blocking your artery. Not eliminating it, but slowing its growth. Buying time. The dose is 1 regular strength tablet, 325 milligrams, not a baby aspirin, not 2 low-dose tablets if that's what you have, though low dose is better than nothing. 1 regular strength aspirin, chewed completely as soon as you have called 911 and are in a stable position on the floor. Do not take aspirin if you are allergic to it, if your doctor has specifically told you not to, or if you have active bleeding. If you are unsure, skip it and tell the paramedics when they arrive. The first 2 steps of this protocol stand on their own. These 3 steps, stop in position, call and speak, chew and wait, are the cardiac first response protocol. In the time it takes most people to decide whether what they're feeling is serious enough to act on, you will have already completed all 3. You came into this video not knowing what to do in the moment that matters most. You're leaving with a protocol built on published research, 3 steps you can take in under 60 seconds that directly influence whether your heart survives the next hour intact. Stop and position. Call and speak. Chew and wait. That is the cardiac first response protocol. Say it out loud once before you close this video, because the research is clear. People who have rehearsed a response, even mentally, act faster and more effectively when the moment arrives than people who know the information but never made it their own. There is someone in your life right now, a spouse, a sibling, a parent, a friend over 60 who does not know any of this. Not the cortisol surge, not the 4 words to say to 911, not why chewing matters. Share this video with them today, not for this channel, because the information their doctor never had time to give them is right here, and it costs nothing to pass it on. If you haven't subscribed yet, please do that now. Every week, I bring honest, research-based information about what your body needs after 60. the information I wish every patient had before they ended up in front of me. Everything I've shared today is based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, your daily routine, or your emergency plan, please speak with your own doctor first. They know your history. Bring this information into that conversation. That's exactly where good medicine begins.